If you believe everyone deserves a place to call home, whether they live in McPherson or across the country, you can make it happen. At Housing for Good, we shine a light on housing challenges, spotlighting real people, real stories, and solutions shaping communities near and far. And with your support, we can go further in ending instability for good. Donate now at McPhersonHousingCoalition.org to help transform shelter into stability for someone, somewhere today.
Welcome to Housing for Good, a podcast dedicated to housing topics and issues affecting our communities in McPherson County and beyond. With years of experience and expertise, hosts Chris Goodson and Carolyn Moore discuss housing challenges and opportunities with other experts from a variety of housing fields.
Hello, everyone, and welcome to another episode of Housing for Good. I'm your host, Chris Goodson. And today, before we dive into today's conversation about housing, I want to talk a moment to reflect on something that's been weighing heavily on my heart, the violence that has been shaping our communities and our country recently, from the heartbreaking assassination of Charlie Kirk to the tragic loss of young lives like those affected by the Antioch High School shooting in Tennessee. It feels like every week there's another reminder of how fragile life can really be. It's natural to feel angry or scared when you see these things happening. But today, I want to encourage us to channel those emotions into action, into building up our communities rather than tearing them apart. That's why I'm so excited about today's episode, because while we can't control every act of violence, we can make a difference by supporting organizations that bring healing and hope. One of those organizations is Grace Med Health Clinics, which provides compassionate, accessible health care to those who need it most. And today, we'll explore how they identify needs, build trust, and create healthier communities, one relationship at a time. And I'm thrilled to welcome our guest today, Juven. So welcome. Did I say that right,
yes,
Juven?
Thank you so much.
Okay. So tell me a little bit about yourself and a little bit about Grace Med.
Yeah, so my name is Juven Nava. I'm the Director of Community Outreach and Communications at Grace Med Health Clinic. I have been at Grace Med for 14 years.
Wow.
Yeah, I started out as an outreach coordinator and then moved up and built my team. I like to tell people that I started at Grace Med back when we only had 5 clinics, and now we're at 14. So I've seen the organization grow to fill the need that is out there for the community. My background is in social services, so I've always worked in nonprofit. I kind of fell into healthcare just because I wanted to make a positive change. I wanted to work administration and really be out in the community and things like that. So I had this opportunity to work at Grace Med, and I've been there since. So thank you so much for having me.
Oh, that's so awesome. I think healthcare is something that we often overlook.
Yeah.
And homelessness and the lack of housing, they go hand in hand. And people don't understand that housing is healthcare.
Right.
So what you're doing is so important in our communities to provide that for people, especially those who don't have very much money, or they don't have any type of insurance and all of that stuff. So I'm really excited to hear about your mission. So how do you and your team figure out what the specific health needs are in the communities you serve? So you have McPherson, and I don't know where all you are, but is it different in different towns? How does that work?
It very much is. So we are in Wichita, Clearwater, McPherson, and Topeka. So we serve all of those counties and all those surrounding towns. What we've noticed is that we really look into the communities to see what is needed. And so what we look at is basically health disparity surveys. That's done by the states, it's done by the federal government, things like that. A lot of it has to come from the community itself. That's exactly what happened with McPherson. They came to us and said hey, we have this need, it needs to happen. And so that's what ended up happening, is that we really look to see what is that need in that community. So if it's either there's a high population of older adults, so is there senior care? Are there uninsured children in the area? Then we're going to focus on Medicaid enrollments and pediatric care, things like that. And so we really take the time to really look at these surveys and to evaluate these communities based upon federal and state need that they see. And that's how we determine the services that we're going to provide.
Oh, that's really great. So basically you're listening to the communities that you're serving, figuring out you're not just coming and I'm here to save the day.
Exactly.
And then doing whatever you think they need, but you really are bringing that to the community, the healthcare that they need, even dental. You do some dental, right?
We do medical, dental, vision. We do podiatry. We do pediatrics. We also have a pharmacy.
Wow.
We have vision. I like to tell when I'm doing outreach is that I like to tell people like basically like a one-stop center. You can just come and receive all those services that's very much needed. Everything is done on a sliding fee. So even if you are insured, we ask you to bring your proof of income to see what slide you'd fit in. We see uninsured, insured, everyone who needs those services.
Sometimes even people with insurance can't really afford to make all of that work, deductibles and medications and we really struggle. I think there's a lot of working poor. I don't know if that's an appropriate term or not, but I think they're the ones who especially struggle with not only housing, but trying to get that health care that they need. If you're not feeling well or you have some kind of an illness, it's pretty hard to go to work.
Exactly.
And without a job, obviously, you can't keep housing or anything else that you need for your kids.
Right.
So what are some of the initiatives that you think have worked really well? I mean, what is something that you've done that you're really seeing, wow, that's really made a difference in this community? Or
I really like your introduction when you were talking about the importance of housing. So back in 2012, I have had experience working with the homeless population. And that was an initiative that I really started at Grace Med was to start our homeless outreach program. So where we offer free medical and free dental services to our homeless population. Now, it's a self-sufficiency program. So it's one of those things where we try to educate our homeless patients on, we don't want you to be homeless, right? And so we want you to be able to schedule your own appointments, follow your own treatment plans and things like that. So we've partnered up with numerous organizations that provide those services that as long as they provide a letter verification stating that that individual is homeless, they would qualify for the program. And so we tried to spend time to educate them on the importance of taking care of themselves. One of the strongest initiatives that we started back in 2011 when I first started is to try to get more patients to use Grace Med as a primary care provider versus using the emergency room. As you mentioned earlier, healthcare costs is high, and a lot of people don't understand that you can go into medical debt when you're using the emergency room as a daily thing. But I think a lot of it has to do with education and a lack of resources. We do serve a working population. So a lot of times they don't have time to schedule an appointment or go into a clinic and say like, okay, let me wait and do all this other stuff. They want to deal with their medical need as needed. And so they end up using either immediate care or an emergency room as a primary care provider. And that increases cost. And it puts them in a situation that financially it's very challenging. And so we've tried to really do some grassroots efforts to do some community outreach to get them to understand that Grace Med is here for you and is a great place for primary care for you to schedule in. So back in 2012 also, we started these clinics that are attached to schools in Wichita. And a lot of these clinics are attached to Title I schools. So schools are very low income that receive a lot of free lunches in the neighborhoods because the barriers that we saw that a lot of our families had were like transportation, scheduling hours, or even being accessible to get their child to go to a clinic. So being right next to school gives the parent the ability to, before you go drop off your child, or if you're able to just go pick them up real quick and come to the clinic and get them, get their checkups or their dental or vaccines or anything like that, you can take them back to school. You're not losing so much time because we understand that people's time is very sensitive. And it's very valuable because they got to get to work.
They got to get to work. Yeah, some of these people work 2 or 3 jobs.
Exactly. And if these clinics are in their neighborhoods, they're not having to drive far to get the medical care, the dental care that they need.
I don't think people realize how expensive not only for the families if they have to move to the emergency room, because sometimes they can't pay that bill.
Right.
But then that falls back on people who pay taxes, people who support the hospital. And that's something that that's why we're really happy that somebody like Grace Med is here to give people that option because it costs not only for like I said, not only for the families, but it costs the entire community. I mean, we were showing in one of our instances, as we're able to get people housed, those costs go down significantly.
Yes.
So they're not having to go to the emergency room. They have a doctor to prevent some of these things. They can stay healthy so they can work and support their families.
Yeah.
I mean, I don't know that people understand how connected housing and healthcare really are. They're just so interconnected.
Right.
So how do you build trust with people? So if you're working out in the communities with families who are struggling and you're talking about dropping kids off and then running over to the clinic or the homeless population, How do you build trust there where they even want to talk to you or see you? Or, I mean, I know sometimes people feel very uncomfortable talking to somebody who is part of a group or part of somebody trying to help them. You know, how do you do that? How do you build trust?
Yeah, that's a great question. You know, one of the things that I learned through my experience, especially in community outreach, that's where I started, was that if you build that relationship with the community, word of mouth is gold. The other thing too is that you have to be reliable and you have to be consistent. We can spend a ton of money in doing commercials and boosting our social media ads and things like that. But like, if you're not building a relationship with the community, they're not going to come. Education is very important. So we really focus a lot on grassroots efforts. So I do have a team of community outreach reps that they spend time out in the community building those relationships with community partners like local churches, food banks, local organizations, things of that sort, that to give them an opportunity to really educate the population on the importance of having a primary care provider and the services that we can offer. Consistency is very important and something that we really focus on, building that trust, building that relationship, getting to know them, because what we've noticed with our patient population is that every story is different. Every journey is different. You know, things are situational. You might have a family who has multiple jobs. You might have a family that's multi-generational. You might have a family that's moved to Kansas because Kansas is more affordable than other states. And you might have family who are dealing with financial issues. So it's one of those things where we're having to spend a lot of time just building those relationships and really educating them on who Grace Med is.
As far as encampments go, if you have do you go into encampments at all? Are you able to do that? Is it safe? I mean, what does that look like?
Yeah, so we do have a homeless outreach nurse. We actually have 2 right now who go out to different encampments and shelters to really visit our homeless population, to build those relationships. I obviously want them to be safe. And so I don't want them to go out in places that are not going to be safe for them. And so a lot of times we definitely do it during the day. We do it with support. We mostly focus on being at the shelters than versus like under a bridge or anything like that. Usually if it's someone who is staying outside, there's day shelters that we've worked with that we kind of have like clinical offices where they can just come by and receive those services. But again, that also starts in the interview process when we're interviewing our outreach nurses and letting them know the population that they're dealing with, and also making sure that they have the personality and that they know what they're getting themselves into. Transparency is very important for us.
That's a tricky job, because I had a sister-in-law that did that for a while, and she said it was heartbreaking a lot of times with trying to work with the population because they don't trust people. And it was very, very difficult for her to be able to do that. She did a great job, but it was very, very hard for her. And I know, and then you were talking about safety a little bit, and we feel that same way about our staff. We don't just send them out. We have to make sure the situation is very safe. We've had a couple of scary situations. I'm like, okay, that wasn't a smart thing. Don't do that again. Everything was always okay, but it was like, wow. You know, even in our small town, you would think that those types of things can't happen, but they can happen. And a lot of times what we see, and I don't know if domestic violence is something that you're dealing with as well, but that twice when we had some situations that were a little bit dicey, it was domestic violence. And I was like, okay, this is our new policy, and this is, you know, you make policies as things occur. So we're like, okay, here's our deal now. This is where you meet somebody. This is how you do it. You always make sure there's somebody there, you know, make sure the perpetrator isn't around or whatever.
Exactly. So, and you have to spend a lot of time training them and things. And it's one of those things, too, where we've also had to talk to our providers that if you have a homeless person yelling at you or cussing you out or anything like that, why are they doing that? Some, for the most part, they're usually doing that because no one listens to them. Yeah. And that's the only way they know how to communicate with them. And so don't take it personal.
That's good.
You know, learn to see, maybe bring down your tone, maybe change the wording, repeat what they're saying so that they know you are listening to them.
Yeah.
It's not only the responsibility of teaching our patients how to communicate with us, it's also the responsibility of us teaching our own staff how to communicate with them as well.
I love that. That's really good, to being able to repeat back what they said to you so they know you're hearing them, because sometimes I feel that way sometimes where somebody isn't listening to me. And so I'm like, should I raise my tone?
Right.
Or how do I make this person understand where I'm coming from without getting louder and louder? I used to do hearings for some different things. And my boss always said, if you want to get someone to like calm down, lower your voice. because they will lower their voice to match your voice. So if you lower, I was like, I've used that for years. Somebody's like, I can barely hear you. Right. Well, I'm just messing with you because I'm using my skills on you to lower my voice. Exactly. But it does work if you can figure out those tools and teach them to your staff. Yeah. That's really cool. Okay, so collaboration, what partnerships have been most impactful in your collaborating? You've talked about churches, and you talked about shelters. What are we missing there a little bit?
Oh gosh, well, if I listed all of our partners, we would be here forever. Okay. But I'll just give you some general ones. We really focus a lot on the school districts. We focus a lot on public libraries. We focus a lot on, like I said, food banks, United Way, multiple shelters, things like that. We really try to build those relationships. We've even built relationships with other community health centers that we're in this together. There's enough patients and people who are in need that we don't have to be competing against each other. We need to be there for one another. We've built relationships with private practices, Chamber of Commerce in different areas, just to try to educate them a lot. I want to mention that last year, just to give you a general idea, we did over 4,000 community outreach events.
Wow.
Just in Kansas itself. And that's, again, the grassroots efforts. That means going to parent-teacher conferences, local fall festivals, even if it's setting up a lobby sit at a public library just to be there and building those relationships. We've been very blessed with having those community partners.
That's really awesome. Okay, so we'll skip around a little bit. What about social media? How does the digital age, what does that have to do with what you're doing? Do the people that you're serving, are they all over social media? Do they typically not really? I don't know.
Yes, and it's something that we're building. It's something that we are working on. We do have a strong social media presence, Facebook, Instagram, TikTok. We have all those things. During the COVID pandemic, we had to do a lot of facts over myths on TikTok just to try to educate people on COVID and the vaccines and things like that. We do participate a lot of it on social media because we know that's what people go to. That's what they listen to. And so we really try to focus a lot on whoever we're highlighting on social media are people you're going to see at the clinics.
That's smart.
I think it's very easy. And that's something that when I took on marketing in the communications department that I really wanted to focus on, that we didn't focus on stock photos. I wanted you to see people who you're going to see at the clinic. I want you to build already that relationship. I want to see familiar faces. So we really focused on that.
You feel like you know the person already.
Exactly.
Right. It's funny. I was thinking about when you were talking about TikTok. So you have to be careful on TikTok because I looked at alligators. And now every single time I get a TikTok, it's an alligator. It's like, don't look at it. Don't look at it. Right. So hopefully the people that you're reaching are not looking at the silly stuff that comes on my social media, but really something that's important. Yeah. I know you can say a word, like just talking. And then when I get this iPad back to my office, everything we've talked about will start popping up all over my Facebook
That happens to me all the time.
I know.
All the time.
I know. So health disparities are huge issues in many communities we serve. How is Grace Med addressing those health disparities that are going on? Is there specific things like free clinics? I mean, we talked about that a little bit. Transportation support, is that something? Education initiatives, but you're talking a lot about going to different things, but are there specific education initiatives or transportation support? Or what if I can't get to you?
Yeah, I mean, transportation is always an issue, and it's been an issue before with us. Well, it continues to be an issue even with our homeless population, is transportation. And so we've had to work with local governments and seeing is there any sort of like bus passes that we can give or any kind of transportation. I know some of the things that we've looked into has been like Uber transportation, but then we get into just it's a lot of like red tape and things like that. A lot of initiatives, what we look into is and things that we see that are in the community that are very much needed. For example, like in Topeka, we saw there was a huge need for pregnancy maintenance to have, support for new mothers on what does this look like? I need someone to come and help me and to educate me on what it is to be a new mom. What should I be expecting? Help me go through my treatment plans, things like that. How to get connected to local social workers and things of that sort. And so we do have a PMI specialist in Topeka that provides those services. We also saw that, I would say 6 years ago, that Kansas was one of the states that had a large number of youth that could qualify for Medicaid that didn't have Medicaid. And that was because it was tough to get on Medicaid and to fill out the application. A lot of parents wouldn't fill out the entire application or didn't know how to fill out the application. And so we received funding from the federal government to help to get a lot of kids signed up for Medicaid. And so that initiative goes across 29 different counties, where we go to local organizations and meet with them and help them fill out the Medicaid application and help them see the process through, so that way they can get access to the healthcare. We have seen a lot of initiatives even when it comes to, local. I know in Wichita there was a water contamination issue. We were the first ones to do the testing for TCE. And so it just really depends on what the need is there for the community. We're going to try to build partnerships to try to get these issues resolved. We can't do it all of ourselves. We are a nonprofit, so our funds are limited. And so we have to find ways to get creative, if that's either applying for grants or if that's working with local governments to help support that financially. And we just do the operational things. That's what we will do.
That's amazing. I mean, just you're doing so many different things. And like you said, you're a nonprofit, so you have to have partners all over.
Right, exactly.
I mean, I don't know. McPherson Housing Coalition, I think we have 41 partners throughout the county only. We're only countywide. We're not statewide like you are. But this work is just so important, and trying to make sure that you're covering everything, that you're bringing in services that people need, you're educating people.
Exactly.
So what recent campaigns or programs have you seen really move the needle forward in what you're doing right now? Has there been something recent that you guys have done, a recent program or initiative that's really working and you're going, wow, that was a good one?
Yeah. So I would say most of our largest initiative has been so far is trying to get kids enrolled into Medicaid, which is our Healthy Kansas Kids project. That's a partnership that we've worked with the state of Kansas with to do the Medicaid application process in the 29 different counties and get them fully eligible. That's been a great success. We have enrolled over 2,000 children per year on Medicaid, and that's also been an assistance for pregnant women. We do have the PMI program in Topeka, the Pregnancy Maintenance Initiative, that has really worked really well. One of the things that we noticed about 5 years ago is the importance of mental health. So we brought behavioral health into Grace Med, and so we have our behavioral health consultants working with our providers to provide those services that's very much needed. We also saw that there was a kind of an epidemic of high blood pressure a couple of years ago, and we partnered up with the city to provide blood pressure cuffs and digital scales to our patients for free, so that they're able to monitor their high blood pressure and to also help our diabetic patients. It's so hard to keep track of things that we've done.
I know. It's a lot, right? You look back and you're like, wow, did we really? You were talking about filling out those forms. I think those forms are tricky, even for somebody like you and I who do this type of work all the time.
Right.
I'm like, you want to know what?
Yeah.
Where am I supposed to find that at?
Exactly.
All the different, sometimes they ask for Social Security cards or numbers or driver's license stuff. And some of our families don't even have half that stuff or don't have any idea where it is. But that's very complicated. I've noticed that too. It's hard.
And we have a community cares department at Grace Med that really helps our patients do that. And the reason why we do have people to do that is because we notice, when you will know, if you're unhoused, that affects your health. If you don't have electricity running during the winter because now you don't have heat, that affects your health. If you don't have access to counseling services, that's going to affect your physical health. Everything affects your body. So we're trying to find ways to help you resolve. So if we can have a community care worker help you fill out your Medicare application, or help you fill out your electricity assistance, or help you with your rent assistance application, that's what we're going to do, because we want you to get healthier. Yeah. Our goal is for you to come see us less because we want you to be healthy.
I know.
But we want to make sure that we're taking care of you as much as we can.
That's really good. Okay. So everybody has some kind of obstacles that they're facing. Are there some big challenges that you'd like, if you had $1 billion, or that somebody in the community, maybe somebody's listening to this and they're like, oh, I could fix that for them. What are your obstacles? You have to have some. We all have them. We all have them.
Where do I start?
Where do I start? Well, okay, it's only a 30-minute deal here, so you can't only take a few minutes.
I definitely, and this is more going to be because I'm a very selfish person. Being the person that oversees the homeless outreach program, transportation, definitely. If we can find someone that can donate vouchers for us for transportation so that people can get to the clinic, that would be great. If we could also get funding for prescriptions, that would be amazing. Prescriptions are very expensive, and sometimes seeing people go through the difficulties of getting their prescriptions it's heartbreaking. Housing is obviously very important. Getting food is very important. There's just certain equipments that we need within our own facility to help cover some of those things that we just don't even think about until we're dealing with that patient. We have a great development department. Nancy Dooling, who's our director of development, does a wonderful job of meeting with local organizations and people who want to support initiatives like this to help us get some of those needs taken care of. We have 2 big events that we host. Our Say Grace Thanksgiving Day race in Wichita that all the funds go to patient vouchers. And we also have this Hotcakes for Hope Care event that we do to help raise money for patient vouchers to help us. And every year it changes depending on the need that we have at Grace Med. So even if we can get the community to participate in those events, it's great. The 5K race on Thanksgiving is the largest 5K race in Wichita.
Wow.
And it's become such a Thanksgiving tradition that we actually have people traveling from different states who come to the race.
Oh, that's awesome.
I think one time we had someone from California and even the Caribbean islands who were visiting family and decided to do the 5K race. Just signing up for that, I mean, that funding helps us to take care of our patients.
That's awesome. Wow, what a great service that you're providing to the state of Kansas.
I appreciate
that's incredible.
That.
Yeah,
you're doing a great service
thank
too.
You.
Thank you.
Yeah, it's partners like you that really make our work possible. We know at McPherson Housing Coalition we can't do all this by ourselves. We need health care, we need mental, we need food, we need so many things to keep our families stable and to help them move forward.
Right.
And healthcare is like the number one thing in our mind. If we can house them and keep them healthy, they're going to have a chance. Their kids are going to have a chance, and they're really going to be able to move forward in their life and to be able to be successful and healthy and happy and all those kind of things. So thank you so much for sharing your insights today. This was an incredible interview. As we close, I want to circle back to something we discussed at the very start, violence and division in our communities. Organizations like Grace Med remind us that there's another way we can choose to be people of peace and service. Here's my challenge to everyone listening today. Find one way this week to give back to your community. It could be anything. The food bank, maybe Grace Med needs you to mow their lawn or something. I don't know, whatever. You can help with the Housing Coalition. You can help. There's so many different groups. Meals on Wheels. I mean, I could be here all day listing those, but give back to your community. Be part of the solution. And I will all live in places that are going to be so much better. That's where I want to be. That's where I want to live. That's the communities I want to see created. So you're such a big part of that. So each act of kindness is a small step toward building the world that we want to live in. Like I said, it's where I want to be. Thank you for tuning in to Housing for Good. Let's keep doing good together. So if you'd be interested or know someone who would be interested in being on Housing for Good, drop us a line. Please leave us a review at housingforgood@mcphersonhc.org. Thank you for listening to Housing for Good and have a great day.